Hello everyone, I want to describe the series of lecture on the cardiovascular system tangent to the central nervous system. In this chapter, we will learn anti-anginal drugs related to disease and related to a different disease, how we manage the anginal pectoris portions. Before going into the brief descriptions about the types of the angina pectoris, I want to describe what is our angina pectoris. Angina is related to a pain, and it is a chest pain, squeezing pain on the chest related to imbalance between the oxygen requirement or oxygen demand of the heart and oxygen supply to it via coronary vessels. There are three types of the angina pectoris. The first one is atherosclerotic angina or effort-induced angina. It's related to a patient complaint when I want to do some work or exercise or felt main pains on different parts of the body or squeezing pain on the chest or breathlessness. In these conditions, we give nitroglycerin drugs to treat the classic angina or effort-induced angina. In this case, the coronary artery obstructions are produced, which leads to a reduction of coronary perfusions and then related to an increased myocardial oxygen demand. Then we move into a variant or vasospastic angina. Is related to, we can say it is a rest angina. In this condition, vasospasm is the spasm of the arteries. And related in the rest conditions, the patient complained when I am at rest, I felt a squeezing pain on the chest. So we can also to treat these types of the angina by giving nitroglycerin or calcium channel blockers. The third one is the unstable angina. It is an emergency case and it required a hospital conditions to treat unstable angina by giving a sublingual nitroglycerin. Depends on the conditions of the patients. The first one, in the unstable angina, it is related to acute coronary syndrome. The acute coronary syndrome is related to increased level of the cardiac markers like creatinine kinase, and the second one is a troponin. And it's also a non-ST segment elevations due to myocardial infarction in the unstable angina and acute coronary syndrome. Then we move on to the nitrates. We can therapeutic strategy about the calcium channel blockers, then beta blockers, sodium channel blockers, and it will realize what are the side effects, what are the mechanism of these drugs. Now we move on to the step-by-steps. Anti-anginal drugs related to nitroglycerin. It is a three types. Nitroglycerin, we can say it is a three types: sublingual, oral, and transdermal. In the oral sublingual condition, it does not pass a first-pass metabolism and does not go drugs to the liver. In the oral condition, it is metabolized 90% of the drugs, so it's give rise to a 10% effective on these conditions. Then we move on to the different type of the isosorbide dinitrates and isosorbide mononitrate and erythrolyte nitrate, and we can say different nitrates is also given in these conditions. Nitrates are also effective. Then we move on to a beta blocker. Beta blocker are two types. It has a selective or non-selective. In the selective conditions, propanol is non-selective and metoprolol or the atenolol are the selective drugs on these conditions. Then we move on to the calcium channel blocker. Calcium channel blocker have two types. It has a dihydropyridine calcium channel blocker and non-dihydropyridine calcium channel blocker. The verapamil, in this condition, verapamil and diazepams are non-dihydropyridine reactions. And the other are like a dipene are dihydropyridines are conditions. Then we move on to the calcium channel blocker. We can describe in the step-by-steps in this incoming conditions. What is the mechanism of the nitrates? When we given nitrates on vascular smooth cells, it's present in the conditions of arginine in the endothelium, and it's released due to a nitric oxide synthase and release nitric oxide and goes to a blood vessels. It moves to and activate the guanylase cyclase mechanism, and GTP converted into a cyclic GMP. Cyclic GMP is related to a dephosphorylation. Myosin light chain phosphorylation is a contraction process, and when dephosphorylation occurs, it's converted into myosin light chain relaxations, and venodilations, arterial dilations, and coronary arteries. Then dilation of the capacitance vessels related mostly in the venous portion. It gives rise to a pooling of the blood in the veins and decreased venous resistance over the heart and decreased preload. We can move into a preload. Preload is related to sympathetic activity. Then we move into a decrease in the end-diastolic pressure, which decrease in the oxygen demand and increase the supply of the cardiac muscles to oxygens. Then we goes into arterial dilations. Nitric oxide mostly act on the veins, but less effective on arteries. Very less effective. Then decrease peripheral resistance and decrease afterload. Peripheral resistance is related to systolic factors. Peripheral resistance is related to a systolic factor, then into a heart rate, heart force, and ejection time related to ejection fractions. Then we move on to the description relaxations of the arteries. When coronary artery is relaxed, it decreases the afterload and decrease the peripheral resistance and decrease the double products of the heart. Relaxation resulting in this relaxation of the smooth muscle of the bronchi, biliary and esophagus. In these conditions, there will be more effective anti these drugs. We can say adverse effects. Before going into the adverse effects, I want to describe the double product mechanism. What is a double product? Double product is equal to a multiplication of heart rate multiplied by arterial pressure, systolic blood pressure. When the heart rate will be decreased, it related to a double product will also be decreased in these both conditions. So it related to when preloads are 1 is returned, it's most effective on the sympathetic activity. Now we move on to the adverse effects of the nitric oxides or nitroglycines. The most adverse effects are related to a postural hypotension or reflex tachycardia. Then we move into palpitation, lightheadedness, tolerance in one-day disease when patient come with in these conditions, industrial disease caused by a chronic exposure to a vasodilating concentration of organic nitrates in the workplace. When the patient has working in the industry, he has been relaxed and goes to home in Saturday and then comes on the Monday. Due to a tolerance insufficiency, he felt a pain on Monday. So it's called a Monday disease. Then it is a throbbing pain. Throbbing pain is due to a meningeal artery due to vasodilating more blood passed into the meningeal artery and felt a pain mechanisms. Then we move into the methemoglobinemia, methemoglobinemia, high doses at these conditions. In these conditions, nitrates are given on the different conditions, but cyanoids, hemoglobins, in the sodium nitrates, sodium nitrite, it's not a nitrate. So be careful, it is a nitrate, nitrate. So hemoglobin is converted into a methemoglobin. When cyanoids will combine with methemoglobin, it converted into a hemoglobin and sodium thiosulfate with methemoglobin. So it's excreted. Sodium cyanoates is excreted in the urine. We can say in the different, before going into the calcium channel blocker, I want to describe the sublingual and oral and transdermal. The sublingual have mostly effective in 10 to 20 minutes, and it's effective on mostly 4 to 6 hours, and it has a 24 hours duration of the pharmacokinetics. So when we give one and the isosorbide dinitrate, it's sublingually it's effective in 30 minutes. It's most effective drugs. Then most we can say it's a three route of administration sublingually, orally, and transdermally. But we can give these drugs intravenously. Intravenous nitroglycerin sometimes used in unstable angina, reduced platelets aggregation. So there are no clinically useful effects on the other tissues of these portions. Then we go into a calcium channel blocker. The calcium channel blocker mostly effective on the L type of the calcium channel blocker. So the main mechanism of it binds to a alpha-1 subunit of the L type calcium channel blocker and they block their activity. Like calcium influx will be decreased. Decreased in transmembrane calcium current, smooth muscle relaxation is produced, decreased contractility and decrease in the pacemaker activity. So there are different mechanisms about it. There are two types, dihydropyridines and non-dihydropyridines. But we can say when calcium influx, it is a more adverse conditions in the calcium. If it does not block calcium channels, it's a more effective in ischemic portions, ischemia. So in ischemic condition is more effective because membrane of the depolarization that produced a hypoxia. This promotes the activity of several ATP consuming enzymes, thereby depleting energy store and worsening the ischemia. So when a patient complains with the ischemia, we can give only the drugs calcium channel blocker to inhibit the worsening of the ischemia development that leads to a different disease. Then we move on to a verapamil is a relatively cardioselective drugs and mostly effect on the atrioventricular node. AV nodal drugs. Relatively smooth muscle selective is a nifedipine and diazepam is an intermediate selectivity. Mostly we can use is a verapamil drugs. We can say Verapamil is atrioventricular conductivity. When synovial nodes signal comes into the atrioventricular node, then into the Purkinje fibers through. So it's the most effective verapamil on cardiac muscles. It's the most effective on cardiac muscle. Then nifedipine is a smooth muscle for them. We can say in these conditions, therapeutic uses of cardiac channel calcium channel blocker in this condition is angina pectoris. In the hypertension disease, like we can say antihypertensive drugs. It is also cardiac arrhythmias, verapamil diazepam useful in supraventricular arrhythmias. So we can say in this condition, if the ECG shows that supraventricular arrhythmias is produced, so we can give mostly the choice for the treatment of the supraventricular drugs is a calcium channel blocker. Calcium channel blocker. Then we move on to it is a hypertrophic cardiac myopathy, renal disease. Nifedipine, felodipine decrease the frequency and severity of the attacks, and it is used in the prophylaxis of the migraine. If the patients have migraine attacks, and but not throbbing pain, throbbing headaches, we can use prophylactically. But nifedipine as a uterine relaxant in premature labor. So in these labor conditions, we can give uterine contractility drugs that is related to different chapters. So before going into detail of the other type of the drugs, we can say the main mechanism of the adverse effects of calcium channel blocker. I learned this chapter related to the adverse effect like a happy December. We link this in this portion like a happy December. Happy is related to a hypotension, and D related to E related to a constipation, and E related to a edema, and D related to a convulsion, dizziness, like that. Mostly effective is a dizziness. So remember this formula like a happy December. In these conditions, we have hypotension like edema, like constipations, and like a dizziness related to it. And then we move on to beta blocker drugs. The main beta blockers related to it, beta 1, beta 2, beta 3 are the G stimulatory proteins. When beta blocker agonists are given, it moves increase level of cyclic GMP and increase level of G stimulatory proteins activation. But when we come beta blocker drugs, then we used as inhibits G stimulatory and cyclic AMP level, and it used as a prophylaxis drug. Beta blocker is a non-selective at a high dose and can inhibit beta 2 receptors. Non-selective beta blocker avoided in asthma. Why? While it is the most USMLE are the most effective questions in the UHS exams are in different types of the professional exam. In the beta 1 agonist, like beta 2 agonist, these are used for asthma, like albuterol, salmeterol, formoterol, iodinosterol. But if we use the beta blocker drugs, it worsens the effects of the asthma. So be careful about to selective in the treatment for the asthma. Then there is a new type of the drugs, newer drugs or ranolazines. It inhibits the late phase of the sodium current, improving the oxygen supply demands, and both in these conditions. Reduced intracellular sodium and calcium overload, and it is mostly used in anti-anginal drugs, and it also used in anti-arrhythmiotic drugs. So when we use this ranolazine, if other drugs are not effective, all drugs not effective, so we will use these types of the drugs. Then we move on to the treatment strategies, and in the different diseases like asthma and these conditions, we can move what type of the drugs will be given in different disease. So before going into the treatment, we can say normally, if the patient does not have disease, we will use anti-anginal drugs. If the patient just complains only angina, we will use sublingual. In acute conditions, used sublingual. Then move into the beta blocker. Then we add or the calcium channel blocker, or it will have options for them, calcium channel blocker or long-acting nitrates. If the patients have the nitrates condition, then we move into these conditions. If the patient is not recovering from this disease, then we have a last option to give ranolazine. Then we move on to the different strategies about it, like if the patient having diabetic patient complain of different types of the disease. Before we will compare what the effects are, the side effects of that drugs, like beta blockers drugs have a hyperglycemia, like hypotensions related to it, related to beta 2 blockers drugs. Beta 1 blocker selective drugs, we can say it to decrease the hypertensions, it related to hypertensions and decrease the blood pressures due to a renal angiotensin mechanism and related to a heart contractility. But in diabetes, But in diabetes, we can choose mostly these are long-acting nitrates. Then we can also have option for calcium channel blocker. If the patient have so because in diabetes we cannot use beta blocker drugs. Why? This is a question. We can use beta blocker drugs. It will increase beta blocker agonist increase the hyperglycemia. Beta blocker agonist, and then we can use the beta blockers. It can reduce the hypoglycemic effects, but it can different conditions which cannot treat it properly. But we have option to treat by giving beta blocker drugs. In asthma or chronic pulmonary disease, obstructive pulmonary disease, we have a best options to treat long-acting nitrates and then plus calcium channel blocker. We never use calcium channel. We can never use beta antagonist like beta blocker drugs. This is the main questions. In the hypertension, we can mostly use long-acting nitrate, but we have also options by giving beta blockers or by giving calcium channel blocker. If the patient have a recent myocardial infarction, we never used calcium channel blocker, but we have options for giving long-acting nitrate and then beta blocker drugs. Most commonly effective drugs these act on it. So we can in last describe the questions about it to solve it, and then we move on to different type of the strategies and different type of the disease related to this scenario, and we can differentiate about it. So be attentive. This scenario was given 45 years old woman with hyperlipidemia and frequent migraine headache. So developmental of these conditions, which of the following is relatively contraindicated because of her migraines? So first of all, go to selections of the drugs. Before going into metoprolol, it is related to beta blocker drugs. It's not related to a migraine headache. It causes the hypotensions, bradycardia, and related to reflex hypotensions. Then we move into a nitroglycerin. Nitroglycerin has a drug used for sublingually a different portion, but it causes a throbbing headache due to a meningeal artery. Verapamil also have options. Verapamil has also for options to treat the migraine, but it is not a migraine headache, so it cannot be used in these conditions. Albuterol is related to treat the asthma in the acute conditions. So we cannot use albuterol. It not cause any migraine treatment in contraindications. So aspirin is also antacids. We never use to treat it. So the best option to give this answer about this hyperlipidemia patients and have migraine headaches and develop angina pectoris disease, we can give best option for a nitroglycerin drugs. So be attentive to solve these questions about it. Thank you so much.